This was very sudden, and I knew what it was right away, and I was terrified.
Dr. Jennifer Hulme caught COVID in April 2022. She's been sick ever since.
I wasn't able to parent my child. I couldn't do very basic things with him. Even just sensitivity to sound and noise, you can imagine how that affects your relationships.
She's still suffering from long COVID. A new paper compiled research from more than 150 studies and warns just how bad the condition can be.
It really is very complex and very heterogeneous and very challenging.
It finds COVID to be a multi-organ, multi-system disease that can cause organ changes even in the absence of a symptomatic disease. It mentions other studies that point to infections causing micro blood clots and the virus remaining in the body. One of the authors says around 10% of everyone who caught the illness gets long COVID.
There are maybe 400 million people in the world suffering from it.
The paper warns the oncoming burden faced by patients, healthcare providers, governments, and economies is so large, it's unfathomable. And it comes with many of this country's healthcare workers already burned out. One epidemiologist is calling for a patient registry to track symptoms and treatment to learn what best helps patients.
There are a lot of people who are not going to physicians even because they have given up hope.
Hulme says she's almost back to where she was before she got sick. Based on her own search for treatment, she says governments need to create more capacity and accessibility so patients can get help.
We really have to focus on empower people on what to do when they do get sick.
With so many people affected, it's a massive challenge, one that could last as people suffer from long COVID. But right now, no one knows how long that will be. Nathaniel Dove, Global News.